Okay, so ladies and gentlemen, we've just calling up AnyLogic, and I'm going to treat it as if you're using it for the first time. AnyLogic takes a little bit of time to load. It's a very powerful, quite full-featured program that has a lot of components to it. And while it's loading, it shows this kind of splash screen. When it first comes up, the very first time, there'll be something special that will be shown to you, okay? And you don't have to expect that every time, but what you'll see is something like this, okay? You should see something like this. Now, if you've used it before, it may look a little bit different, and we'll see that in a moment. But you should see something like this, where there's kind of a splash screen, and it gives you some references to get going. I want to highlight the fact that there's lots of good references here, okay? Lots of good items that you can access. I would particularly note here, there's an example models area, and our group, the Computational Epidemiology Public Health Informatics Lab here on campus, has contributed some of these models, but you can go over to the example models and you'll find a fair number that are in the health or healthcare area. We will be opening some of these today. Right now I'm just kind of orienting you. But some of these we will actually see in the course of the day. Most of those we will be, I'll be providing you the models. So this is an area to acquaint yourself with AnyLogic. Now, how many people need a little bit more time? I've just asked you to call up AnyLogic for the first time. Okay? No one? A little bit more time? Okay. Okay. So are we having a connection issue, or?
Yeah, I need to download the model from my.
Okay, because I have a thumb drive if you need it. Okay. Okay. Okay, ladies and gentlemen. So I just did something which I stand remiss as normal for not emphasizing. There's a welcome screen, and up here in the upper right of it, let me see if I can recreate what you see. There's something like this, minimize. Do you see that? It's a little thing there, minimize. So I'd like you to press that minimize, okay? And when you minimize, you should see something like this, which is perhaps considerably less inviting. And we're going to be getting to know these different areas of the screen here. But basically, they're going to provide different sorts of information for you about your model and allow us to run models and alter some assumptions about these models. These models are what are called dynamic models. They're a way of packaging a theory about how things in the world might work into what I call an operational form, a form that you can understand how it leads to behavior over time. So it's a way of sort of taking our theories about the world and asking, okay, if that theory were true, what would we expect to see over time, and maybe over space or over networks as a result? It's a way of thinking through our assumptions about how the world might operate and seeing their logical consequence in a way that's more reliable from what we can do in our head. We're going to come back to that point. But for now, we're going to be conducting that work in this framework. So what I'm going to ask you to do, if I could, is to go grab that model in, to go open that model you just downloaded. And I'm going to go through, as I am wont, that same process. So I'm going to do File, Open. You can also press Control O on Windows, or I think Command O maybe on Macs. And you're going to go to your downloads, wherever you put downloaded things on your computer. You probably know where that is. And what I'm going to go get here is the model that I downloaded, which was called Smoking Disparities version 8. That was the model we just went and clicked on, and we saw that horrendous thing, and we pressed download. Do you remember that? Okay. So we're going to go select that model, find that model on our computer in the downloads area, and we're going to say down here, OK, to open it. And it's going to go load in that model into AnyLogic, okay? This dynamic model, this model that involves dynamics, behavior over time, okay? So this model is going to be loading in here. And we're going to then explore this model a little bit for what it shows, okay? Here we go. It's a little bit slow. I don't know if it's because I'm recording a video or what here, but here we go. Okay, so ladies and gentlemen, you'll see that while it's still loading, it's put some features up here. So ladies and gentlemen, these dynamic models we'll be working with, I'll be going through a more systematic exploration a bit, but I actually find that students absorb more of the conceptual material if I show them a concrete example, even though it will be a buzzing, blooming confusion, okay? It'll give a very concrete sense of it'll give you particular things to wonder about. How do I interpret that? What does that mean? It'll give you a point of reference when I'm talking about conceptual things. Too many people approach this issue of system science, dynamic modeling, complexity, complex systems, and really lofty, fancy, highfalutin words. And there's a role for that somewhere, but in terms of communicating it, I find it really helpful to show concrete examples, okay? So this is a concrete example. Let's go take a look at this model, okay? So I'd like you to you'll notice that over here on the left, there's a thing called projects. Do you see that? Yeah. Okay, this is going to show you projects that you have loaded, and within each project, it's going to show you the structure of that project, okay? It's a model. And this model consists of several pieces. One of them is this thing called person, and that's going to denote, if we double click on that, your computer doesn't have to make that sound, but if you double click on it, what you will see over here in the right is some illustration of a theory of personhood with respect to this model. Ladies and gentlemen, these models, like all maps, they involve simplifications of the world. And like maps, they can be useful because they strip out a lot of unnecessary detail for a particular interest. Here, ladies and gentlemen, what we see is a depiction of kind of a theory of personhood, where a person can be in one of three states with respect to smoking, and a person can transition from a never-smoking state to a current smoking state according to some hazard rate. That's associated with this initiation rate. And you notice we can click over here on what's called the canvas. We can click on particular transitions and see something about the logic behind them. So you'll notice this relapse transition, for example. If I select it, over here in the properties window, it will show me information about the logic behind it. In this case, it's given by a hazard rate, a kind of chance per unit time. And you'll see something there that looks a little bit like by a statistical hazard rate that you might see in a competing risks model and a survival analysis model, okay? So this is a kind of a formula giving sort of what's the chance per year that someone will go from a former smoker state to a current smoker state. So these transitions, these states indicate with respect to smoking, what are the different states someone could be in? And then a person's going to evolve from one state to the other over time. They're going to go from being a current smoker to being a quit smoker, a former smoker. And then they're going to come back to being a current smoker, potentially through relapse. And the chance that they will relapse will vary based on how long they've been quit. So if they can stay quit for a long time, they're a lot less likely to fall back into smoking in the next year. If they've been quit for 30 years, they're very unlikely to fall back into smoking compared to if they've only been quit for 6 months. Okay? So this is a model of kind of how a person might evolve, the current states they can be in, and how they might evolve between those states over time with respect to smoking. Up here, you'll see another state chart. This one has to do with pregnancy status. One of the things we capture here is the effects of in utero exposure to nicotine. And so a woman here can be in a non-pregnant state or a pregnant state, and you'll see a somewhat different logic here. For example, we characterize in this model, for simplicity, that a woman delivers, comes to term in exactly 9 months here, according to a timeout. So it's not a hazard rate, it's a timeout. We could have specified it as a hazard rate, but we decided that for simplicity, we do it as a timeout. So this describes sort of a theory of personhood, but there's some other aspects of that theory. For example, there's some information about their socioeconomic status, the sex of the person, obviously of great significance here for pregnancy, the birth time, when they were born, the equivalent of birth date that we might see in administrative data, whether they were exposed to nicotine in utero. These are sort of characteristics of the person. And these characteristics are not changing over time. In contrast to their smoking status, which changes over time, according to these state charts, their characteristics here are things that are fixed. We call them parameters. So if you click on one of these, you'll see it's a parameter here, okay? Called SES index. And there's some other parameters as well. For example, who their mother is. We can capture family structure. And in what smoking category they start for those who are sort of initially in the model. We can also keep track who their children are. Okay, now, this is all fine and good. This is kind of a theory of personhood, but what's its significance? Is this just a bunch of pretty pictures? Far from it. Let's go right-click on baseline, and I'd like you to click run, ladies and gentlemen, okay? I'd like you to click run here, okay? And what you'll see is that it says starting experiment, and it goes through a little ritual to get it going. So it's translating this model, this theory of personhood that I described, into a runnable form where I can actually go run this model. And what we'll see is a whole set of people. They're arranged in networks here, okay? And some of those individuals, for example, are current smokers, some are former smokers, and over time, these individuals are linked up to others and can affect attitudes towards smoking in nearby neighbors within this network. Now, each of these individuals, if we go up here and we drill down here, we can go look at population. How did I do that? I went up here. I went to main, and I drilled down to population. We could see a particular person right now. This person is not pregnant, and they're a never smoker. They've had 0 children yet. They, in fact, started in the never smoker state. And over time, they're evolving. Time here is measured in a continuous level. We can go up and see another person by clicking here. This person is also a never smoker, and we can click amongst them, okay, to go from one person to the other. Okay, so here, ladies and gentlemen, we have playing out a kind of logical consequence of that theory of personhood we described with respect to person. This gave a theory, and if you looked here more closely, what you might have found, and I should have dwelled on it, is, for example, initiation is affected by a number of things. It's affected by SES index. It's affected by whether the person was exposed in utero to nicotine. The idea being someone may get into the habit of smoking, crossing that threshold of smoking 100 cigarettes in their life if they were exposed in utero. But it also depends on the number of their smoking connections, their connections to others who are smokers. And so you'll see kind of dense clusters forming of smokers, and then there's whole other areas with few smokers, because there's some social component here being modeled to smoking. So if you look at this, what you're seeing here over time at an individual level and at the level of the population as a whole, that is kind of the logical consequence of this theory of personhood that we've depicted here with these state charts saying you can be in this state or that state and that state, and these are the rules for your transitioning. This is how the hazard of transitioning from here to here depends. But ladies and gentlemen, I'd invite you to go further. I'd invite you to right-click on this area here, right-click, and on a Mac, I think it may be Option-click. I'd nodded there. Option click, is it? Or no, to go up, to scroll around. You use the mouse. Okay. So try option click and drag. I'm right clicking and dragging. Can you folks see that? Okay. So we're going to need TA help. Could TAs try to figure out what it is on a Mac?
You just have to hold down both, like a right click and a drag.
Both?
Like on a Mac, you right click
Oh, you put both your fingers down and drag. Okay, thanks. I have limited exposure to that newfangled technology. Okay, so ladies and gentlemen, up here on the upper part of this screen, I dragged up, and what you're seeing here is of both conceptual and practical significance. What we're seeing is kind of a summary of what's going on below at an aggregate level. So it's taking all the details about what particular state someone is in. You know, this person is a non-smoker, the next person may be a current smoker, and it's taking that across the entire population of people, and it's summarizing this in a variety of graphs over time. So you'll notice this, for example, up here in the upper part, we see smoking prevalence among those exposed to smoking in utero versus among those not exposed to smoking in utero. So of those who were exposed in utero, what fraction are currently smoking? Ladies and gentlemen, down here is overall smoking prevalence. Over here to the right, what we'll see is age distribution for smokers and non-smokers. And not unexpectedly, you see that smokers tend to be starting to smoke somewhere in there between 10 and 20 years old. And you'll notice here, there's actually a depiction for those who are former smokers. How long did it take them to relapse into smoking? After they quit, how long did it take them to fall back for those who have fallen back? Over here, further to the right, we're seeing another interesting depiction where we're following this population at an individual level, and each of these dots represents a particular person. Okay? What we see here on the horizontal axis is a representation of their income, their SES. And on the vertical axis, we see cumulative years smoked. And what you'll see here is that individuals across the SES spectrum, from 0 to 1, it's kind of a normalized scale. Those individuals do smoke across that SES spectrum, but there's a somewhat greater concentration of smoking in the lower sides of the SES spectrum here for this model, and you'll see a sort of general decline here as the SES level goes up and the propensity to smoke. So this is cumulative years that each individual has smoked, and if you run this model further on, it stopped here after 100 years, but if we were to run it further on, we'd see some upwards movement. Here we see an illustration of the disparities associated with this model. This is cumulative person years smoked among high SES, and then we have a cumulative person years smoked among low SES individuals. And you can see among low SES, the number of pack years smoked tends to be higher in this model. Yes, question?
Dr. Arthur, this is really interesting, but I just can't help but wonder,
Yeah.
it's the Epidemiological, but what is the underlying data structure? Like, where is this information coming from?
It's a great question, and we're going to be diving into that for much of the morning. So this information, I'll quickly try to address it, but I want to tell you that we're going to be approaching it in a more structured fashion in a bit. The information that goes into a model like this is information of a variety of sorts. If we consider, so I do quite a bit of work with biostatistical models. They're incredibly valuable elements of the toolbox of techniques that I use, and they work hand in glove with these techniques. But they're different in terms of what goes into them. With a statistical model, what we're often seeking to do, not without exception, but what we're often seeking to do is to identify associations between different factors. Perhaps it's risk factors and some outcome, right? So we might perform a logistic regression, for example, to try to identify significant risk factors that predispose someone to an outcome of some type of adverse health event. Or we might examine a competing risks analysis and try to understand the hazard rate ratios associated with different factors. What that model is highly contingent upon is data. Okay, it's specific data, and models like this, many of them will have a very close working relationship with data in 3 different ways we'll be coming to. But In addition to that, there's often a lot of understanding that goes into models like this that's not merely data. It's about the structure of the system. It's about the posited relationship between factors in the world that might be called reasonably theory. So here we've characterized, for example, an individual's progression among very straightforward categories: never smoker, current smoker, and former smoker. But in other models, there might be a less obvious set of divisions. For example, when it comes to something like TB, which we maybe talked about today as a case study, as time allows, we might have an individual divided up into a set of health states, and there's some reasonable disagreement that might occur between experts in that area as to what those health states should be. For example, should there be a state specifically of primary TB that's distinguished from other states of active TB? To what degree do we need to represent those who have latent TB just for a short time versus for a longer time? So there's a theory of kind of, with respect to the topic being discussed, that often goes into this model. And then in terms of some of the dynamics of it, what you'll often find is that biostatistical models are going to inform the identification of the hazard rates that apply here, for example, between these states. So that's one place that a biostatistical model might inform this model. In addition to that, though, when we run the model, and I had the misfortune of shutting it down here. It would have been a great illustration, but perhaps some of you have it still up on your screen. When you run that model, you will see behavior over time. Remember those graphs we were looking at? One thing that we might do there is ask, to what degree are those graphs representative of information we see from the world? And we cross-check and interrogate the model to try to identify inconsistencies. A model like this can be thought of as a way to more thoroughly think through our assumptions about how the world might work in terms of their implications for behavior over time, in terms of what it would mean in terms, if we had this applying in the world, what would it mean over time, so that we can more quickly spot inconsistencies between what we think is going on in the world and what we observe. I'm going to come back to that point several times during the day. But in short, what goes into this model a lot of the time involves some theory about the world, some theory about how the stages people might go through relevant to the health conditions of interest, the steps that one goes through when one goes as an emergency patient to RUH. What are the stages one goes through? There's a triage stage. There's sort of a CTAS level that's estimated for you for your level of acuity. And if you're sufficient, you'll probably wait for a little bit. Based on your acuity, you will be taken, be given a bed when one's available. There's a logic to that. And these models encode that logic so that we can ask, well, what's the implication of that logic for behavior over time? But not just that. So, ladies and gentlemen, we just ran what's called a baseline scenario. It's a reference scenario. It's not particularly a privileged reference scenario. However, one of the biggest uses of these models, one of the biggest interests, is to not only explain patterns we see in the world, but to ask what-if questions about counterfactuals. What do I mean by counterfactual? I mean a situation that we haven't had the luxury of seeing directly. We haven't had the luxury of collecting data about it because it hasn't yet happened. This is significant, that statement, because when we try to understand the world, we can get tremendous insights from statistical data when we have observations that have occurred. But there are many times we want to ask, what should we do? What decisions should we make? And we're talking about outcomes of those decisions which have never been observed before, which have never been seen. Maybe we're talking about changing the rules for what nurse practitioners can do versus doctors when it comes to primary care delivery. Maybe what we've been talking about is what if we instituted a new mechanism for control of childhood infectious diseases like pertussis that involved performing immunizations when an outbreak is in progress. What if we were to think about a new policy regime which involved changes to how patients who have finished their acute care steps and are waiting for beds in the community, how those patients are handled, whether they're sent to rehab or convalescent homes, or how many of them are kept in the acute care unit until a bed's available in a long-term care facility. In short, we're often thinking about what-if questions. What if we change the system in this way, or that way? We don't have data about the outcome because it's never happened yet. We want to reason about it, and that's where these models really are often seeing their most keen need or the most keen demand. It's to ask what-if questions. And I'd like to walk you through a few of these, okay? So ladies and gentlemen, what I'd like you to do is to go and go over here to the left-hand side. You'll notice that there's a whole set of these things marked with an X, okay? And X marks the spot, ladies and gentlemen, here for what's called an experiment. This is a scenario. This is a situation where we are taking this kind of theory of the world and we're saying, well, what if this theory applies and we were to undertake some change to how things are currently in the world? What if we were to, for example, lower the occurrence of relapse by 10% in individuals? Suppose we could, through Nicorettes or nicotine patches or some other mechanism, suppose if we had an effective quitline system here in the province that was really tailored for certain groups, suppose we could lower the risk, the hazard rate of relapse by 10%. How would that play out in terms of smoking? And so here, we might go down to that, okay? And we're going to say, we're going to run that scenario. How did I do that? Well, ladies and gentlemen, I went over here on the left-hand side. These are all scenarios. And I can right-click here on this, and I can choose Run. And that's saying I want to run this particular scenario where I'm positing this change in the relapse hazard. And then I can say Run, and I can see how that plays out. Now, what's notable here, folks, if we go down, and we'll see this, and we'll run it out for 100 years once again, and if we go down to the level of particular individual, and we're to reflect on this, at first blush, it might seem a fairly obvious computation. Because after all, we're lowering the chance, if someone gets to the former smoker state, that they relapse. So doesn't that have obvious implications? Well, yes and no. If someone's currently a former smoker, and you're asking in the short term, do they become a current smoker, it's fairly obvious what the implications are. But once you start unpacking this, you realize it's not so simple, just like in the world. Among other things, if fewer people relapse back to become current smokers, there may be fewer children that are exposed in utero. Maybe that woman who's a former smoker and is avoiding relapse is a pregnant mom. And maybe you've avoided a whole new generation being exposed to in utero to tobacco that otherwise would have been, to nicotine in utero. Alternatively, though, there's also a depiction here, you may recall, in terms of likelihood of initiation, there's a way in which initiation depends on not just one's age, not just one's SES in a fixed way, but the number of connections you have who are smokers. If you prevent a given individual from relapsing into smoking, that's one less person to tempt others to uptake smoking, or one more person that might get someone else to quit smoking as well. So there's these ripple through effects. And a model like this provides a way of totaling up those ripple through effects, both the direct effects and the ripple through effects. The effects that play out through my social network, the effects that play out through mother-child relationships, the effects that play out through impact on the environment or impact on health service demand. And it allows us to sort of ask what-if questions where all those things are taken into account. And so having done this, playing this out here, and you could see babies are being born individuals are dying, etc., that the population is turning over. And we're going to go here to this model, and we can go drag up here. And if we had been prescient enough, we could have taken down notes earlier on sort of what was the prevalence of smoking overall down here on the lower side, this overall smoking prevalence, prevalence of smoking among different levels of education. And we could have said, how did that 10% reduction in relapse change how this plays out over time? So this model is kind of totaling up this theory and playing it over time. Now, does that mean that this theory is correct? That this theory is, that the model is a crystal ball? Far from it. Ladies and gentlemen, models like this are just as fallible as our thinking, as fallible as our understanding. But what they do allow us to do is more quickly identify a latent mismatch between what we think is going on in the world, as captured in this kind of theory of personhood, and identify mismatches between that and what we actually observe from the world. So they allow us to more quickly identify flaws in our thinking. They allow us to identify places where we've had blind spots because we didn't think through the theory with quite enough precision to allow us to recognize, it doesn't add up against the data in the world. So a model like this is not a crystal ball. Crystal balls are fragile things. And if a model were a crystal ball, it were off, it could be viewed as being a shattered crystal ball. It's a failure. Models like this are tools for learning. They're tools for improving our thinking about the world and for spotting inconsistencies more quickly. So this model has allowed us to ask this what-if question, and we could then go and ask what-if questions. Well, what if we could reduce relapse by further fractions? How would that affect things? We could go run the model for that scenario and run it out and see what the implications of that are. And we could see across different socioeconomic groups and so on. But I won't belabor this point because I do want to get onto some conceptual material, but I want to highlight a few things. It's not anything particular about relapse. We could say, suppose we had something which lowered risk of relapse and enhanced chance of cessation together. How would that affect things? Or we could have a targeted intervention, one that focused very particularly on certain subgroups of the population. For example, we could have strong intervention targeting those in a certain age group, say ages, the young teenage years, for example. Suppose we were to focus our efforts in there. Or suppose we were to focus our efforts on pregnant women and getting them for the duration of their pregnancy at least to stop smoking. How might that affect things? Might it be cost effective? These are the sorts of questions we can pursue in a model like this by seeing the implication of our understanding played out. As we'll see, models like this exist for different purposes. Some models are designed to help us think through what possible theories might explain data that are used for theory building. Other models like this, ladies and gentlemen, are used for taking a theory that we think is pretty solid because it jibes with past evidence, it seems to hold a lot of water, it's been checked by many experts involved in different aspects of the system. We've gone through a basic vetting with it. It seems to accord with patterns we see in administrative data, etc. We can take a theory that's fairly well developed and we can ask what-if questions. Okay, if this is true, then what would the implications be for interventions? Okay, so models like this can be used for theory building, and they can be used for theory explication, like the explication of what's the implication of that theory for decision making, for both those purposes. We could explore this model for hours. We could spend all day, on this model. But this is not a privileged model. This is a teaching model, like so many of yours today. It's designed to run on the version of any logic we have rather than the full professional version, and it's scaled down. This is a sort of type of model that we tend to build up in our boot camps with participants, and that participants seek to build in our incubators. But I'd like to turn from this model to a little bit of understanding about what we're seeing here, why we're seeing it, why we're pursuing this. Before I do that, are there any questions you just got to get answered right now before we turn to some slides that will better and more systematically try to put this in context? Questions? Okay. Were people able to run this? You're able to see some of the graphs and so on? Okay. I'm never quite sure. Okay. If you want to close a model in any logic, you can do File, Close, and that will close out the model. Of course, some of you who may have more interest may want to play with it on the sly while I talk, and that's okay too. Okay, I'm supportive of enthusiasm. Okay. So, ladies and gentlemen, this is our first glimpse of an initial model, and I'm going to save that.